Hi, I'm Natasha.
I'm Julie.
And I'm Katie.
Before teaching about the big consumer issue of euthanasia, which is assisted suicide, we are going to interview a few of our friends to see what they think about it.
We wanted to see the awareness of euthanasia in the public, so we are interviewing them to see their knowledge of it.
We showed each of our interviewees a video about Grace Lee, who wanted to end her life, and her parents were resistant. She has both feeding tubes and breathing tubes. Do you know what euthanasia is?
Is that when someone gets taken off life support?
No, I do not.
No.
An accurate definition of euthanasia is deliberate and intentional act causing death, often administered through a lethal injection. This is a voluntary request of an individual who is incapable of causing his or her own death.
If you were a nurse working in a hospital, how would you comment in the following situation? If a patient is depressed and came in and said that they wanted to kill themselves and they have tried to commit suicide multiple times, would you consider them a person who could ethically participate in euthanasia?
I don't think this person has a reason to end their life. There could be like a cure for depression, so there's no need.
I don't think they should have the choice to, because they're not fully mentally there and they're just depressed, and that's why they want to end their life.
I do not. I think that as a nurse, it would be your responsibility to get a person from the psych ward and have them evaluated and maybe kept in the hospital so that they can stop their suicidal thoughts and get better, and definitely not kill themselves.
How about in the situation when your patient states that they want to die to put an end to their pain and suffering, or that their lives have lost meaning because of their debilitating illness? Would you consider them a person who is ethically able to participate in euthanasia?
This situation sounds better to me because they have an actual reason to want to die. They're physically ill and don't want to live anymore, and that's understandable.
I think it's a very circumstantial thing to have someone die on your hands, and I guess it depends on what their illness was, but I'm not sure that I would be able to give them a lethal injection even if they were in a lot of pain.
After watching a video about Grace, Sue, and Lee, have your initial opinions changed about euthanasia?
I think she had the right to want to end her lives, and I don't think it should have been up to her parents. She could barely even function as a person anymore, so I think she should have made that decision. I think it was a good decision for her to make.
In her case, I would probably give the lethal injection, because if she's in that much pain, there's really nothing else you can do, and I'm pretty sure there's nothing that will make her get better. I think she's just she would just be sick for the rest of her life, and that's really no way to live.
If this were your family, would you be accepting of letting go a loved one who is in Grace's situation?
I think if it got to the extent that they were so miserable, then yeah, I would want what's best for them. I mean, it would be hard to see them die, but in the long run, I think it would be an easier choice than to watch them suffer for the rest of their natural life.
Now, do you understand why euthanasia is such a big consumer issue in the world today?
Yes, because ending your life is a big deal and something you have to think long and hard about.
Okay, yeah, I think it's hard to make a decision about who lives or dies, and then, but I think if you're going to be in the medical profession, you kind of have to separate yourself from your feelings and kind of go off what's best for the patient. I mean, if it was my family member, I definitely wouldn't want to see them die, but as a nurse, I would hope I would understand that that was the best thing for them.
Nurses, as well as doctors and other medical professionals, are faced daily with issues that affect their opinions about the meaning of life. A nurse's own religious and personal factors sometimes oppose the way their patient is being treated. This is a very difficult thing for many nurses because sometimes they have to do things they don't believe in. An issue that comes up daily in hospitals is euthanasia. This is an issue every day for nurses because they may not believe that this is a proper way to treat a patient. According to Marvin Cole, euthanasia can be defined as the painless inducement of quick death. Euthanasia can be divided into two subtypes. These two types are active euthanasia and passive euthanasia. Active euthanasia can be defined as injecting someone with lethal medicine in order to end their life. Passive euthanasia can be defined as ending someone's life by withholding drugs or any life support from them. Both types of euthanasia are issues that affect consumers at large. Studies show that 54% of medical practitioners support euthanasia. Research studies also show that 86% of the public support euthanasia for the terminally ill or people on life support. In a poll taken in July of 2012, 42% of Americans support euthanasia, 22% of Americans were unsure about euthanasia, and 37% of Americans opposed euthanasia.
According to the medical dictionary, the literal meaning of euthanasia is good death. It is considered a slippery slope issue, meaning that people's moral, ethical, and religious values are being tested. This also involves the idea that allowing assisted suicide would inevitably lead to more morally questionable or unacceptable practices. This debatable issue has dated back to 5th century BC. The Hippocratic Oath prohibited doctors from giving a deadly drug to anybody. In the 1st century to the late Middle Ages, the Church seemed to have more effects on people's thoughts on suicide, swaying people not to choose the route of euthanasia because suicide is a sin. When the 14th Amendment was approved, euthanasia became a crime in most states because it was looked as assisting a suicide. Due to the community at large coming together, acts and laws have been recently passed to set regulations. The Self-Determination Act of 1990 allows a patient to refuse treatment of any kind. By 2008, Oregon, Washington, and Montana voters approved Death with Dignity Acts to legalize physician-assisted suicide. An influential person in this controversial issue is Dr. Jack Kevorkian, who recently passed in 2011. He was a euthanasia activist, also known as Dr. Death, infamous for his strong conviction of publicly supporting terminal patients' rights to die, which sent him to jail. His famous saying is, "Dying is not a crime." Kevorkian's patients include those such as Marcella Lawrence, who suffered from heart disease. She explained, "I wish the lawmakers could have my pain for one night, because they don't truly know how it feels to want to end their life due to pain and suffering." Kevorkian helped those die in non-painful ways through lethal doses of medication and some through overdose of carbon monoxide. Today, people's thoughts have changed. Almost 50% of people support euthanasia, although it is still being debated.
Nurses are constantly struggling with ethical dilemmas during their daily professional lives. Choices nurses make can greatly affect others' lives. Therefore, making the correct decision of actions is essential. Nurses must be able to effectively collaborate with patients and their families to make decisions while simultaneously following the standards of proper healthcare they have learned. The ANA, American Nurse Association, Code of Ethics for Nurses is a guideline of care which professional nurses are permitted to follow. One of the most thought-provoking situations that may question the ANA standards is the controversial issue of euthanasia or assisted suicide. There are other acts similar to assisted suicide acknowledged by RN Mary Ersick as active euthanasia and withdrawing treatment. In active euthanasia, someone not only makes the means of death available, but serves as the direct agent of death, said in ANA. According to the ANA Nurses for Nurses, it is not ethically acceptable for nurses to be a part of the active euthanasia process. The role of professional nursing is inconsistent with the active euthanasia. Nurses work to promote, preserve, and protect human life, also stated in ANA, which is the opposite of ending it. They do not have the responsibility to take the life of another. Therefore, euthanasia is not part of the role of nursing. Ersick examines the nurse's role in euthanasia by viewing the guidelines of assisted suicide in Oregon, where it is legal. It is unclear to her what nurses must do when presented with a patient who is asking to die. Ersick thoroughly studied this existing dilemma and came to the conclusion that the nurse's role remains to assess patients and families, evaluate capacity, discuss treatment options, and provide comfort care, and that it is not their job to administer lethal drugs to assist their patient's death. The consensus remains that the nurse has not in the past and should not in the future be an active participant in euthanasia due to the ethical controversies it presents. Through this video, we have displayed the reasons why euthanasia is such an important health consumer issue. Everyone has the chance of possibly being affected by it and should know their right to make their own decision.